it seems like when it comes to obesity and diabetes type 2, it is so crystal clear that your lifestyle can make a difference. I'm just a regular person who reads whatever I read in the papers, and I think I'm reading a lot of people saying Alzheimer's is something that you really can't prevent. And then I saw your presentation, I was like, that's fantastic. You're saying that your lifestyle could affect it, but maybe you guys are wrong. If all these other people are saying that there's nothing you could do, why did you come to the conclusion that it can be prevented? And if it's true what you're saying, why is so many mainstream doctors and media are saying that Alzheimer's is not something we have control over?
They're wrong. No more than that? Okay. So, as you saw, we presented data and papers from not just some one-off, study that looked at small little population observation. We're talking about Columbia University. We're talking about Framingham Health Study. We're talking about Adventist Health Study. We're talking about California Teachers Study. We're talking about the Rush Study. We're talking about the Chicago Study. These are the biggest studies in the country. And those are not, just one-off little studies. These are major studies and many, many more that have shown that lifestyle actually affects progression to Alzheimer's. So the data is there. Why aren't people talking about it is because who would be talking about that? I mean, think about it. It has to be somebody that is interested in lifestyle intervention. In a private clinic setting, you don't have the time to do lifestyle intervention because the rate of patient care. In academic setting, if you're at all interested in doing anything beyond pills and surgery, it's in the academic esoteric realm, right? Molecular stuff. So who would be talking about lifestyle? That's already been shown. Nobody, except some crazy people that want to do something outside. So there's no doubt that there's evidence that lifestyle affects outcome. Absolutely no doubt. But why it's not being spread out is because the venue of spreading it does not exist in the healthcare system. There has to be a venue. If you want to show a movie and you go to a jungle and there's no movie theaters, and then you can't ask, why aren't there movies in this place? Could it be that the movies are false? That was a good analogy.
I like that.
Just came up with it.
There's no doubt, though, that also to add to this, and I'm wondering if it's getting any consideration at all, that the elderly population is swimming in psychoactive substances in a way it never has. And in fact, it's one of the largest consumers. So if you think about people with the most vulnerable brains in our community are among the largest percentage-wise consumers. It would probably be hard in any study of Alzheimer's patients, I would imagine, to find too many that weren't on some psychoactive substance. And is anybody looking at it? I know in psychiatry, nobody's looking at it that I know of, and a few people, maybe in Great Britain, but is anybody putting that into the equation? It's a pretty obvious elephant in the room.
So,
yeah, President.
Short answer is no. It's really not given credence and the attention that it needs in the bigger realm of things, as is lifestyle.
Right.
And I think it's all driven by the fact that, again, coming back to how doctors are trained, we're basically trained in sick care. We just kind of wait with our arms crossed, wearing our white coats in the hospital, waiting for people to get sick, and we see them, when there's really not much that one can do. And what we're talking about, and that's public health. True public health is, catch them before they even manifest that disease. Catch them when they're on that journey towards getting sick. And I think that's true healthcare. So
let me go on to the next thing. So then I guess if you are making a case, if you've written a whole book on lifestyle, and we could ask more about that after, about the specifics, although you did present it in detail. But if you're saying that lifestyle is what you believe is the solution, then why, right now as we speak, are there drugs on the market to treat Alzheimer's? In other words, again, how does this all work? Why would a pharmaceutical company be selling a drug if you're saying it doesn't work? And why wouldn't the media and the politicians and the government agencies be telling everyone, don't take the drug, instead do lifestyle? There's a book, it proves it works. And why isn't the media, why isn't the New York Times writing about it? Like, why, if this is true, isn't all forces of government, media, university, science telling everyone the truth? And instead, and why is there drugs being sold if they don't work? So how is why are we, the Real Truth About Health conference, are we announcing that there's a way to deal with this? What about all these other parts of society that we count on to get this straight? What's going on?
And I'm going to even make it more complicated. There's no conspiracy. There's a flaw in the machine. There are times where there's a flaw in the machine. When the machine is focused towards, to a hammer, everything is a nail. To a disease-based system, everything is a disease or nothing else. And it's so incredibly true here. I'm going to repeat what I just said earlier. I don't want you to this is incredibly important. Although there's a little bit of shift now, because they're seeing what are the mechanisms of interface between people and pre-disease? I mean, we're talking about pre-disease, right? Prevention. Medical students do not deal with pre-disease, only disease. Doctors don't deal with pre-disease, only disease. The insurance companies do not fund for pre-disease, only disease. Because we are so inefficient in treating disease that by itself it's already several $1 trillion. Now you're going to add pre-disease to this? So, and the pharmaceutical companies, there's no evil there. They're going to make money from disease because it's identified, it's a motivator. You're not motivated when you're 30 years old to avoid Alzheimer's. You're motivated when you develop Alzheimer's. And not, by the way, none of the pharmaceutical companies say that their drugs work to stop or slow down the disease. So there's no controversy here. Aricept by Pfizer. Pfizer says our drug, very accurately, appropriately, our drug is a disease symptomatic treatment, the drug. What does that mean? It does not slow or stop the disease. No controversy. They're being accurate. And they even did the next study that showed that it only affects the disease for 4 years. After 4 years, the person ends up the same place otherwise where the curve would have been. So they're not evil. Nobody's doing anything controversially or behind the scene. The machine is focused around when the process comes to the surface. We're talking about pre-surface. So is it more, the question to be asked is it more cost effective to focus on pre-disease? Not yet. It wasn't yet. Why? Because we didn't have the tools to identify pre-disease accurately enough instead of treating 300 million people. So if somebody is a pre-disease suspect for Alzheimer's and it's very accurate and we reduce it to 1 million people, and I'll tell you why, and why people actually have listened to our book. We have had 3 insurance companies come to us, national insurance companies, and others as well. But we even told them, until you can become so specific in your diagnosis, pre-diagnosis, where you can accurately identify the 1 million people that if you, at age 40, this 1 million people, 90% of them will go to the Alzheimer's, then it's cost effective. But if you say everybody's at risk, which I did today, the insurance companies don't have the impetus to spend on all 300 million people. So that's why we're going to the source itself, the population. The insurance companies are not evil. The pharmaceuticals are not evil. The system is set financially to hit the target. And when the target is not known, what are you going to hit? Am I making sense? I mean, so I'm talking about a 40-year-old that doesn't even care that he gets drunk and not blacks out, which affects their brain. That in 20 years, your chance of going to Alzheimer's goes down, goes higher by several months. Do you think they care? That target is not reachable. So that's the system. That's the flaw in the system. So actually, thank you for pushing that because that's... Yes.
I don't know. If there's no evil out there, I don't know who the hell's been trying to beat me up and take away my medical license. And I was going to say, if there's no evil out there, I don't know who's been trying to beat the hell out of me for all these years, go after my medical license, keep me from speaking at universities, cut me off from the media.